Welcome to ABA Inside Track, the podcast that's like reading in your car, but safer. I'm your host, Robert Perry Cruz, and with me as always are my fabulous co-hosts.
Hey, Rob, it's Diana.
And it's me, Jackie.
And as a special treat, even though summer vacation is over, we still got some people taking some fall vacations, I guess, to join us here in the virtual studio. We've got our special guest, Dr. Shane Spiker. Shane, how are you doing?
I'm good. How are you guys doing?
Oh, it's still surprisingly warm. It's still fun here in the virtual studio, though. Still having a good old time.
There's no AC in the virtual studio.
No.
Oh no.
Shane's here to see all the leaves in New England in the fall.
He's peeping.
That's it. It's too hot here in Florida, and there's too much craziness going on here.
Yeah, you gotta take at least a virtual trip out of there.
That's
Yeah.
right.
That's it.
See the foliage. All the beautiful foliage. But this is not a leaf peeping fall foliage New England cast. This is a podcast all about behavior analysis and behavior analytic research, where every week we take an important topic in the field and discuss relevant research articles. And this week we're going to be talking all about self-care. And since, as he will tell us himself, there aren't too many articles in behavior analysis on the topic of self-care, we're very fortunate to have Shane join us because that is an area of importance to him. And since he had all the fun articles, we were more than happy to let him help us by leading the discussion today.
I always need self-care, and I need people to remind me that self-care is not just drinking wine and wearing a shirt that says mom time.
Oh, I praise any training I'm in. I'm like, what do you all do to unwind? And somebody doesn't immediately jump out drinking. I'm like, I just want to thank you all, because usually everyone starts with drinking and then gets to, the more healthy ways to do self-care. But thank you so much for starting with reading a book or taking a walk or exercising, something that's probably more healthy.
Or like scheduling a doctor's appointment. Like that's cool. Like here's your praise. Because that's the thing is people don't, that's exactly it. It's everyone's drinking. It's like, y'all, you need something. You need a better replacement skill.
Exactly.
Oh boy. But before we get into exactly what self-care is, which is not going to be as short a conversation as one might think, Shane, why don't you tell the audience all about yourself?
First of all, thank you all for having me. I'm so excited. It's so cool to hear the intro in real time and be like, oh, I'm here. I come from the psychology background. My undergrad was all clinical psychology and discovered behavior analysis in that realm, and fell in love with it ever since. Got certified. Have been doing this for about 10 years and work mostly in when I'm doing behavior analytic work, mostly in crisis, working with really intense folks, really dangerous folks. And so I would imagine that's probably informed some of the decisions about self-care that came up later. So yeah, I'm kind of I would say I'm a generalist, work in a couple different areas and just have a lot of fun with it.
You're no stranger to the podcast world as well, right?
I'm one of the current co-hosts over at Why We Do What We Do. So
we had the fortunate treat to be on for your 100th episode. Well, that was a while back at this point, but we were really excited to be the special guest there too. So we're glad you could come join us.
Yeah, I was so bummed that I couldn't make that episode. That was such a sad thing. So we're making up for it.
That's the way to think about it. It's a good self-care forward description.
Right,
description of the process. So Shane, you were saying that you see a lot of crisis behaviors because that is primarily where you are practicing right now. And that's really where kind of the idea of thinking about self-care and then doing research on self-care came from. Is that about right?
I would say that definitely contributed to me seeing the urgency of the topic being studied. When you work in crisis and you work with families that are really intense and you work in these situations that, are really, really challenging, I think that it lends itself to a level of stress that maybe some behavior analysts don't get to experience or haven't come into contact with, because I think there's definitely a difference between losing sleep over whether or not the results of your VB-MAP are cool versus like losing your sleep over whether the treatment you have is working, because if not, this person's going to blind themselves. And so I just think there's this level of stress that's probably a little bit different.
Mm-hmm. That is very, very, very true. And from there, you just decided this is what I want to focus on for a bit of time. Is this something that you're still focusing on, or was just sort of part of the dissertation process?
So I'm still focused on it. And I actually, I focus on it because, we talked about those different stressors, but then like I remember specifically being at one of the state conferences that we all go to and just seeing how much the bartenders were struggling to keep up with the behavior analysts. Just the amount of the volume of liquor that was being shared at the time. I just remember being like, having that moment where I was like, is this how we deal with stuff? And so it started there. And then, I still think it's important. I just think a lot of what I think is important about it is just making sure people know what it is to start and engage in some small step towards, I guess, a better skill set in that regard.
Mm-hmm. So let's talk about the articles we'll be discussing today, as well as sprinkling in your own work from your dissertation on the topic of self-care. But the currently published articles we have that you were so kind to suggest we read for this topic, for this episode, I should say, are Supervision for Certification in the Field of Applied Behavior Analysis, Characteristics and Relationship with Job Satisfaction, Burnout, Work Demands, and Support by Dounavi, Fennell, and Early from the International Journal of Environmental Research and Public Health in 2019.
That one's fancy because it's behavior with a U.
Behavior, as I would like to say.
Behavior.
High levels of burnout among early career board-certified behavior analysts with low collegial support in the work environment by Plantiveau, Dounavi, and Virues-Ortega from the European Journal of Behavior Analysis. And that was published online, I believe, in also 2018. No U on that one, which is weird because it's the European Journal, so you think the editors would be like really checking. Did you spell color right? Did you say Lori, perhaps? And that's all I know. And supervisor support as a predictor of burnout and therapeutic self-efficacy in therapists working in ABA schools, Gibson, Gray, and Hastings, in the Journal of Autism and Developmental Disorders, 2009. And then Shane will also, like I said, be talking about all of the work that you have done in the field of self-care as well.
Yeah, hopefully it's contributed something.
It was a fascinating read. I think the most fun part, I know, having read some of the other articles already, was sort of the flip side it took, because there are a lot of more articles about the idea of, burnout, what's burnout. But when reading your work, it was very much about what is self-care, which, again, I guess you could kind of think of them as flip sides of one another, would you say? Or are they more just separate entities that sort of intermingle?
That's a great question. I think a lot of it is that, because I remember I had a mentor who was teaching me about signs of damage and would always kind of ask the question of, well, what about signs of repair? Like, how do you explain when somebody wants to restore an old car and what the reinforcers are there if we're going to talk about signs of damage on this other side, which is seeing destruction and harm and whatever. And so I remember thinking that as we were kind of going through this and looking at so much burnout, so much work on like the outcomes. And when I started looking at self-care, it was definitely this flip side of like, what can we do to stop these outcomes? What can we do to get better outcomes? And it was kind of, that's where it started was, we talk about burnout. We don't talk about why we get there, how we get there, or what we can do to not get there at all. And so that was when I was kind of going through and doing my lit review, which can be so tedious. I don't think the people, when they say do the research, it's like, you don't know what the research means. Like it's hundreds of articles. So, but anyway, I think of definitely thinking that burnout is one side of it. The self-care is this other side, or just kind of like maybe the crossroads that we can stop at and make a better decision at instead of ending up in that space where we end up with burnout. So yeah, to answer your question, yeah, I think they are definitely interrelated in a way that you can't untangle them.
All right. Well, knowing that, Shane, let's define self-care, which, as someone who has read, like you were saying, hundreds of articles, of which it was really entertaining to see, as you mentioned in your dissertation, hundreds of definitions of what self-care is.
Yeah.
What's the one? Could you give us one now? How would you, I guess conceptualizing self-care might be more doable at the moment than giving like the one precise definition, right?
Yeah. So that was so irritating to go through that. And I found what was great is I found one article that was a meta-analysis that already did most of the work for me. And even they were like, come on, guys. Like we couldn't get one thing down, to the degree that they created 7 domains of self-care in different ways that it applied. So it was really kind of cool to see. But, I think that as we started to conceptualize self-care and really look at the research, one thing I started to see more parallels with than anything else were different skill repertoires or skill sets like social skills. Because we have no problem really defining social skills when we get down to the brass tacks, like what's the actual response we're looking at. But social skills was this like really big, broad domain of behavior that we treat. And so once I kind of started looking at self-care and conceptualizing it from that standpoint, to me, self-care was any behavior or any response that helped to return the organism to homeostasis. Like, I think that was a nice, easy, clean one. Like, how do we get to baseline? How do we get to those places where all of our needs are met? So I started there, and that's about as far as I got.
That still seems hard, Shane, though. That still seems really challenging. Like, what is baseline? What is homeostasis? That seems scary to me.
Yeah, it really is. And I think that's maybe a glaring issue of maybe the current culture of the field, where it's just like, what does it feel like to not have to worry about anything? Like, am I just kind of like the frog in the boiling pot where the heat's just gradually getting turned up, and this level of stress is my new norm? I think that's a, as we start kind of digging into the research that's out there, is that you'll find that there's not really any definition for what that's supposed to look like, or really any discussion about what that's supposed to look like. And I don't know what baseline looks like. I know for me, baseline right now is getting a cup of coffee. I have a cup of coffee in the morning, I start my day, that's getting me to my baseline for the day. But I don't know what like a normal human being lives like.
I don't know. There is one, right?
There's got to be somewhere.
Your wording of homeostasis, I actually like the use of that term, Shane, because it does capture to some extent this idea of the individualization that's going to go into what is your baseline. Because I know that would shift even for me. Like, I can think like when it was summer vacation, and I've been fortunate for the past few years to have one of those sweet jobs where I don't have to work over the summer. I got to work more on the podcast. I get to spend more time with my kids. So what my baseline was is very different than, say, my baseline this past week or two when we're getting ready to start school again. Well, we just got ready to start school again in the fall, and it's very scary because what is the new fall? And what I was doing for self-care a month ago was not what I was doing for self-care a month later, because my sort of level of, I don't know if it's burnout or just my general level of anxiety had shifted so very much in such a short period of time.
Yeah, and I think that is an excellent point in itself, and something that I really try to emphasize to folks is when you start looking at self-care and looking at what those needs are, if the goal is to get your needs met, you have to be able to even figure out what your needs are. And sometimes self-care is having a glass of wine with dinner and just kind of relaxing and enjoying that moment. But sometimes self-care is scheduling that dentist appointment that you didn't make, and it's been 7 years since you've been to the dentist, or, taking a nap, telling folks no. I mean, just setting boundaries, I think, is one of the biggest self-care repertoires that we as behavior analysts probably struggle with the most. And, self-care is going to depend on what your needs are, where the MOs are, and what needs you have to get met today versus tomorrow and the next day.
And I don't think we can have a conversation about self-care without also defining the term that we've been discussing already. Like, everyone knows what burnout is, but we should probably more closely define exactly what burnout is, because at least with burnout, it does seem that there are very clear, overly validated tests that have been used to measure burnout. And there's the idea of the depersonalization of burnout. And I can't even remember the other two. There's the depersonalization, the emotional exhaustion burnout, the reduced personal accomplishment burnout.
Those are all from the Maslach.
From the Maslach burnout inventory. But Shane, could you kind of speak to what those terms are? Because I've read enough articles now about all the types of burnout and articles that use the Maslach burnout inventory. And I still sometimes have to think, well, what does that mean when I talk about depersonalization or personal accomplishment?
And I think that's where a lot of maybe some researchers in behavior analysis, not even researchers in behavior analysis, but just the field of behavior analysis might scoff, right? What is depersonalization? How do you define that? And you get into those discussions. But I think that when you start really looking at burnout and considering burnout, we are already probably talking about behavioral indicators. We're probably already seeing behavioral indicators related to burnout. And so this idea that, we're not really contacting enough reinforcement for the responses that we're engaging in. I mean, we've all had that job. That's been the case. We're burning out because it's a lot of work, it's a lot of response effort, and there's no payout. Every day is a nightmare. And so, when we start talking about burnout, I think that's a way to start conceptualizing it. But, things like depersonalization, I'm sure that every behavior analyst who has had a heavy caseload has probably seen that phone call from a caregiver or from a staff and just been like, I don't want to answer this right now. And you just start stepping away, and so I just can't deal with this person right now. We've all had that moment. And so you start seeing that happen more and more often, right? You mentioned the term emotional exhaustion. Another term that gets used in that is compassion fatigue, where you're just kind of like, you're not as worried about your work. You're not as intense about your work. You're not you're just kind of like, oh, if I get it in a deadline, that's fine. You just kind of like, you just can't care. Like, you literally can't feel any sort of emotion towards that thing. But I think where those two are difficult to measure, depersonalization and emotional exhaustion. When we get into personal accomplishments, that could be like goal setting. And we see this issue of behavior analysts are not meeting deadlines. They are canceling sessions. They are experiencing all these different behavioral indicators of stressors that are going on. And these indicators of burnout that we probably don't recognize as burnout. We probably look at like a minor annoyance or maybe a kind of behavior problem, but they are indicators of burnout that are identified in some of the literature.
I know when I think of emotional exhaustion, I tend to think of sort of, private verbal behavior in which I'm saying things like, I don't think I can. I don't think it's going to happen. I don't have any more ideas. You're sort of giving yourself those negative self-talk statements, for example. That's typically what I'm thinking of for emotional exhaustion. I don't know if those are actually the questions that they ask in the MBI.
Well, and MBI is a survey. And I go back to that issue where you go, okay, so it's a self-report inventory. We know how those turn out sometimes. And it's a self-report inventory based on a lot of social constructs that are tough to measure and doesn't really use great layperson terminology to even describe those things. So, I mean, it's a standardized tool. It's valid. It works. But it's always really interesting when you get into self-report stuff like that.
Mm-hmm. So this might be a good time to talk about, all of the research we'll be discussing today really does hinge a lot on self-report. In your dissertation, you did specific interviews with behavior analysts. And in all of the research that we'll be discussing in terms of the research articles, they used a number of questionnaires. And I guess it really, in looking at the overall results from that, are we just at a point in the field where this is all we can get? We just have to start somewhere? Are there other variables that you've already kind of been thinking of, as you work in your dissertation and your continued work that we should be looking at in terms of direct measures?
That is a really great question. We're just at this space where there is just not enough to even know. And I think that's something that's kind of scary when you get into research, where you start looking at populations and you look at these things. But we're at this space where we could use anything right now. It would be better than what we've got. If we started using a questionnaire, it's better than what we have, which is literally nothing. When we start looking at burnout inventories and behavior analysis, like the burnout inventory that we could use is going to be far superior than anything we have in behavior analysis simply because we lack it and we're not researching it. And so, yeah, I mean, I think that the self-report is the way to go right now until there is a way to quantify this, until there is a way to treat this, or however, or even just research it in a way that's quantifiably meaningful. But we're just at a space where there is just nothing.
So Shane, when we're talking about, the downside of not engaging in self-care, the downside of having high rates of burnout, I know that the articles and the research mentions a lot of, typical patterns that are seen in terms of, higher rate of, individuals maybe like quitting a job or not providing, good services. But are those necessarily measured outcomes, or are those sort of just the assumed outcomes of what research is out there?
There are some studies that do have some quantifiable measures for what these types of burnout outcomes look like. And the problem that we find with that is it's in every other field but ours. So they're measuring it. They're talking about job satisfaction. They're talking about turnover rates. They're talking about people leaving fields. I mean, you see those statistics in nursing, in medical doctors, in psychologists, in licensed mental health counselors. You see them in other helping professions that are similar, but you don't really see it in ours. So, I think that is indicative of the amount of research that's out there. But they are studying that stuff. They are actual behavior indicators. And it's interesting that we have missed that on some level.
Mm-hmm. It's mentioned in some of the articles. Certainly we don't, and you mentioned it here, we don't really know what this looks exactly like in the field of behavior analysis. But would you think that there are specific challenges to our field? Because, I sort of tend to lump some of this research into the idea of, well, we're all human service providers. So I assume that there are a lot of variables, that there's going to be, similarities. So we would expect to see similar outcomes, even though we may not. Did you think of any specific, like, well, I know as a BCBA, or I know as someone practicing behavior analysis, you're going to see these stressors, or you're going to see these variables that probably don't come up as often in the research that is looking at burnout or is looking at self-care?
Yeah, that was actually a really important point as I was kind of going through my dissertation, that they had to tell me that I had to be careful not to color the experience of interviewees as a practitioner, because I was considered at some point in time a participant observer in the research. I know the field, I'm working in the field, so now I have all this bias towards what I'm expected to find. So I had to check that a lot as I was going through my research. But yeah, I think that we do have some challenges. I think that we are as I think Jim Carr put it, a maturing field. Yeah, I was like,
we're maturing like a fine wine. We're maturing.
we're aging appropriately. Yeah, we have a long way to go, and as a maturing field, we're missing certain structures in our field. The funding sources aren't really caught up to our field, but what we're finding is that there is a huge need. I think one stat I saw was 800,000 people are on waiting lists for services across the United States, and that was maybe 10 years ago. So who knows what it looks like now? And you have the situation where our field is growing, the need is never changing, and as businesses kind of pick up and they start going, we're going to get our services in such high demand that we're never going to have time to do anything else. And that's, I think, probably the largest challenge that we're seeing right now is that there's just not enough of us.
And I was thinking too, as I was reading your dissertation, that a lot of times, doctors and nurses don't see patients day in and day out for years.
Right.
Like in our field, we see the same patients or the same clients, the same families every day, always for a long time. And I think that, I don't have any data to support this, but I think this also may contribute to burnout in our field a little differently than other fields, right? Because, we don't get that like change up, right? You might see, like with nurses or doctors, you do see a lot of different types of things. But with us, we're just seeing, kind of the similar trajectory year after year. And I wonder if that would contribute to burnout too.
It has to, right? Because you're thinking of, there's a concept in some of the self-care literature you'll see is called vicarious traumatization, where it talks about the counselors and psychologists will be traumatized by the telling of an experience of one of their patients. So somebody will be relaying their story and the counselor will be traumatized as a result of that. And I was thinking about that and I was like, I don't know that I think that we probably experienced that to some level, but I would imagine that some of the stuff we see is probably more just directly traumatic. I mean, I think of 30 days into my experience, I got knocked out over a can of soda. And 10 years later, I remember that entire scenario. And you have to kind of wonder, like, to what degree are behavior analysts actually traumatized by the stuff they see? Because we're in the homes. We're seeing these clients day in and day out. These families that are seeking services are seeing us so often. And we are there for those emergencies. We are there having those behaviors or those challenges happen to us. I mean, like I said, I was knocked out. It happened to me. So I imagine just the nature of our job is probably more likened to maybe ER doctors or ER staffing rather than just the kind of the day in and day out like you'll see with nursing or those doctors that only see their clients maybe once every year.
Mm-hmm, mm-hmm. Yeah. And I think that we care deeply about our clients and their families, and there can be a really large emotional investment there as well. And I mean, I have many, many stories from families that they've relayed to me that have stuck with me over the years as well. So I think it can be both sides of emotional investment and therefore exhaustion, right? Yeah.
And I hate to paint with a broad brush for other fields of which I'm not a member and I don't know their inner workings, but so many behavior analysts are going into client homes and they're working directly with the family in the place that they live. Whereas even, say, a therapist who's working with the family is probably doing most of that work in an office setting where, you expect certain behaviors to be very different because it's a different environment. And you're sort of in the middle of so many, challenging areas. And it's not the same level of kind of, escape at the end of the day because you're right there. If there's a problem, you're right there while the problem is occurring, as opposed to if there's a problem, you might end your session early. And again, I don't want to paint with a broad brush. I know there's still doctors that, do home visits. There's still therapists that work directly in homes, but that sort of is sort of the hallmark of, the majority of, the BCBAs working today, or many of them at least.
No, absolutely. And I think it's important to acknowledge the context in which burnout is occurring and where we're even talking about things like burnout or self-care. Like that is the context that we are currently working in. We are working in family homes. And, on the rough side of it, you're seeing families split up. You're seeing divorces. You're seeing, children getting removed from homes. You're seeing a lot of really intense situations on that rough end. But on the other side, those positive things are so intense as well. You're seeing this person's first words. You're seeing this kid graduate high school. You're seeing all these things that are really intense. And that alone has to be, the roller coaster in that has to be exhausting. And that's just only a single part of the entire context of what behavior analysis looks like today.
So Shane, when we're talking about self-care, and when you were working with your interview population or your interview participants, you mentioned that there were kind of some starter themes that came out of those interviews. First of all, would you mind kind of just describing the overall process of doing those interviews? Because that was so fascinating. I mean, so much of your work really was dedicated to how are you doing these interviews, like you said, so that you're not there's no bias in the interviews. How are you going through the data of interview format to find these themes? It was really fascinating stuff.
Yeah, qualitative research is just so neat for fun stuff like that. So, I emailed every behavior analyst and I didn't get a response from y'all. So when I was doing my study and my interviews, so I wasn't sure. I was just like, I got a cold shoulder. So, it was.
I remember that email, Shane.
You do? You're like, yep, didn't even read it. It went to my junk mail.
I was like, delete. No, just kidding. That would just be funny. I'm like, self-care? What's that? Delete.
Right. It happens.
I don't have time for this survey.
I'm drinking too much to answer these emails.
I'm sure there was some people out there that were like, I don't need to do this. I'm good. And I think, or maybe even like the self-care. I think that's probably what happened is people saw self-care and they're like, what is this? We're fine. This isn't about DRAs. So I don't need to read it. So as we started doing the interviews, I had emailed everybody, got some interviews, got some behavior analysts together, interviewed only 10 people just to kind of get an idea. And when you do this type of research, a lot of times what you're looking for is like a theme. You're trying to pull a thread to kind of understand what the problem is, if there's a problem, and to what degree that problem is pervasive. So, it's very exploratory in the way that you approach, research interviews. And so when I started interviewing behavior analysts, it was, well, I've never been trained unless I had ACT, unless I was exposed to ACT. I've never been trained formally on this. Nobody talked to me about self-care. And, the questions had to do with, did you have a supervisor who, promoted self-care? Did you get trained at a school on self-care? And so you kind of saw these common threads where people weren't trained. People had some kind of individualized definition. They were they had their own experience with it or they'd been exposed to it somewhere else, but they were working in high stress situations and they would notice their own deficits. They wouldn't say no when they needed to. A lot of the folks that I interviewed could actually report like, yeah, I know I don't do this, but I don't do it anyway. And so it was really interesting to see those kind of things where just nobody was trained. Nobody really knew what it was. Everybody worked in a super stressful situation and just said, I should probably do better.
It was interesting that you were able to come up with those themes for something that really has a very nebulous definition and that very few practitioners have been trained in. It still did seem to center around just a couple key, I don't know if they were phrases necessarily in interviews, but I guess themes being the perfect word in terms of just the same ideas over and over from the different participants. I did find it interesting that the few individuals who'd sort of been doing more work looking at ACT practices had a few more, positive ideas on what self-care could be than, say, the participants who really were just, I don't know, I do this, I do that. I think it's this, I think it's that.
Yeah, that was really, really neat to see. And, if you make that logical jump, it makes sense, right? In ACT, you've got values-based practices and you've got, committed actions related to that. And so if you are kind of contacting those things, like you're going to feel good about it. And so where, I remember being pretty rigidly trained in behavior analysis. And so just thinking of everything being fairly black and white and really intensely looked at like that, it'd be like, why don't you do it? Well, I'm not contacting reinforcement, so I'm just not going to do it, and it's like, it was really interesting to see those folks kind of talk about it in such a way versus the folks that kind of had that more, I don't want to say fluffy language because I know that has its own connotation, but like has that lighter language, that like easier to digest language,
I can't remember, Shane. Did individuals go into detail as to why they didn't think they practiced as much self-care as they should have, or make any statements to those effects, or just there wasn't enough information to sort of point it out as a theme? I'm sorry, I can't remember the whole.
No, that's good. There wasn't anything that was like a common theme for why folks didn't do it. They would just note that they didn't do it. But the joke was always, whenever I'd interview somebody, it's on every transcript, if somebody would be like, time. I don't have any time. Like like we've probably all said, like, what is self-care? What is time? What is free time? That was kind of the prevailing joke, but there was nothing that was overt as far as why folks weren't doing it. They had a lot of different reasons. They had a lot of different exemplars. It wasn't quite as clear as it could have been.
I sort of think of self-care almost like, we did some articles and did an episode where we talked about the idea of procrastination. And sort of thinking about self-care almost as like, well, it's sort of like procrastination in that you have all these MOs, and most of them are going to be work-related and job-related and other-related. I have to do this with my friends or family members. And at some point, you'll hit that tipping point where, the pressure of the MO about, I just need to take a break, I just need to do something else, will sort of push you. And then for a while, you'll engage in self-care behavior until the MOs about your job come, flooding back, and you got to take care of them. That's always how I think of self-care, but there really isn't any reason to think that's exactly what's going on, I would guess, at least that anyone knows at the moment.
Yeah, I mean, we work in such an interesting space that, we can identify things like you said, like MOs, and identify those behaviors and identify those, like, the reinforcers that come along with that. But, it's really interesting to see what MOs kind of get pushed to the wayside. Like, I'll give you an example. I had to get a root canal because I had an issue with one of my teeth, and I put it off for like a year and a half because I was like, I don't have time. I don't want to go to the dentist, and I'm gonna go. I got work stuff to do. I got a behavior program to turn in, and it's like, that is not the excuse to not get your tooth fixed. Like, I couldn't chew on half of my mouth for like a year. It's like so ridiculous.
Yeah, that's longer than I would expect. Just like, I don't need to chew for that. That one seems like something you'd need pretty fast. You can't, I can't imagine putting that off for very long. But
listen. Everybody, that's what I'm saying. It's like people do that, though. Like, I talked to somebody, we were doing a self-care talk, and somebody was like, I haven't been to the dentist in 7 years. And I was like, you need to go to the dentist. It's going to be a problem.
Do you think that's along the lines of self-care, or are you avoiding something, right? Is that like an avoidant behavior because you're scared of the dentist, or the dentist is an aversive, or they're going to tell you like you're going to lose your teeth, right? So is there a component to that?
I think that's where it all gets intertwined. Like, my self-care deficit is that I can't tolerate the dentist, so I avoid it. I think it all kind of leads into stuff like that. I mean, I personally don't like going to the dentist, but when you think of it from the perspective of your health and safety, like that's a self-care need, whether it feels good or not, right? We wash our hair, so that's a self-care need, whether we want to wash our hair or not, for the folks who do.
Always want to wash my hair. I love showering, if you don't know this about me.
It's the best.
Doesn't come up on the show as much as we would think, talking about our own personal hygiene routines. But
that's so true. I shower like twice a day just to escape reality. That's my self-care.
Wasn't that one of the self-care definitions, actually, that you did find in the behavior analytic literature, Shane? Self-care as like ADLs?
That's exactly it. That was my favorite. The two I pulled was one for somebody with special needs. It was a Vollmer article from 1992, and it talked about activities of daily living. And then the other one was a Trahan article from 2016 that was also activities of daily living, but just with a different population.
It was so funny. It was just like, yep, those are the articles on self-care you'd get from our field.
Yeah.
Like, not actually answering the real question you're looking for, just ADLs, very precise.
Right. Well, and it was funny when that came up because it made me laugh. I was like, that's what we got. That's what we got. But then it was like, well, that is part of your self-care routine. Like, getting enough sleep is part of a decent self-care routine to get your health needs met, right? So toothbrushing and wiping and all that, like, to me, they were just a different part of the spectrum that had to do with self-care behaviors, right? So kind of like how social skills have very specific, dating skills are a very specific subset of social skills. And that to me was like, it made me realize, oh, we are tackling it, but not for ourselves. We're tackling it for the folks that we work with in relation to health and safety.
Mm-hmm. Yeah. And if you were to put it in like the Maslow's hierarchy of needs, right? We've only started to look at the very bottom layer.
We did
right?
it.
Like, keeping yourself clean, period. That's all that we've tackled. But there are many other needs that one might approach. But I guess when we're thinking about this, and Rob, like your discussion on procrastination, would anything that you use to procrastinate count as self-care behavior, or should we be thinking of the definition more, finely tuned, I guess, such that the behavior needs to be adaptive in some way or move you sort of towards personal betterment in some way?
Mm-hmm.
Or personal baseline, right? Go back to baseline or homeostasis, as you talked about earlier.
Well, I think that's a great question because I think that there is something to be said about like, well, what are the reinforcers that are in that space? Like, I am a procrastinator. I'm horrible at procrastinating.
Wait, Shane, you're horrible at procrastinating, or you're good
I'm
at
sorry.
procrastinating?
I'm very good at procrastinating. My apologies.
I wish I were horrible at procrastinating. I'm so bad. I just have to get everything done immediately. I can't stop.
You are.
I don't like getting close to deadlines.
That is you. That is you. You are not a procrastinator.
You know what, though? I think if you give me the social validity questionnaire about self-care, I would say, well, that stresses me out so very much because you can't always get things done on time. Because, I work in a public school system where I'm not like the boss of school. I have to wait for other people. And it drives me nuts. And I'm trying not to be a jerk and have it influence my personal achievement burnout. I'm like, I'm not getting anything done.
Well, right. And I think so in that space, though, like for me, procrastination worked really well. I would be able to contact a whole lot of reinforcement before I even started the project that needed to get done. And I would turn it in at 11:59 and it would be done and I would be able to move on to the next thing. And that to me never stressed me out because I just didn't have the MO to do it early. So I think that's when we start looking at that, you have to go back to, well, what's the impact of that behavior? What's the social significance of that behavior? If procrastination is a problem, why is it a problem? For me, it wasn't, but for somebody else who doesn't work quickly or is missing deadlines, then that is a serious problem, right? So I think that's where we start looking at self-care, looking at like, well, what's the result of you not engaging in these behaviors? Like what's happening to you in your life? And are you contacting the reinforcement you need? Or are you losing jobs because you're turning in reports in too late? Or are your teeth falling out because you haven't gone to the dentist? Like what's the actual problem or the outcome?
Yeah, and that does get tricky to define, and it does get to that point of how are you individually going about your day?
Right.
Are you able to function? Are you not able to function?
Your attempts at self-care or return to homeostasis could in fact be unhealthy or detrimental.
Mm-hmm.
Maybe we should do some type of training.
What would that training look like, Hannah?
I was going to ask Shane that question.
Yeah.
The question is there too much self-care?
Well, I think that's a great question because I think that does turn into like, at what point does it become a detriment, right? Like, because that's the joke when we talk about wine. Oh, I get a glass of wine. I get this thing, right? And it's like, well, a glass of wine is not a problem. A bottle of wine could be, depending on where you're at and what happens. 2 bottles of wine might be a different thing. And then a bottle of wine alone, multiple nights a week, you might want to check something out, right? Like whatever that, I'm not judging if that's your routine, but the idea is that, there is a point where, engaging in self-care becomes kind of like you'll see with addiction where too much of it can become a problem. Not liking, getting your nails done to addiction by any means, but the idea that there is a tipping point. And that tipping point is, when does it become detrimental? When does it become harmful? When does it become something that is going to impact you long term? I think that's the tipping point that's difficult to find because it's going to vary by individual.
Right. And there's always a choice, right? When you finally encounter a pocket of free time and you have to decide, like, how am I going to spend this time? And I do, whenever that happens, I try to think, like, what's actually going to make me feel good right now to do, right? We are operating under, I think, pretty high levels of stress and anxiety, or maybe that's just me. So, but it's really hard, just as it's hard to predict what your own reinforcers are going to be. It's hard to, at the outset, say, like, what's actually going to be good for me to do right now? And if I don't properly pick something, then I'll just look through my phone, and that just makes me feel worse. So I've inefficiently spent my time that should have been for self-care on doing nothing productive, right?
Right. Well, there was a meme that was going around that was kind of talking about that. It's like, that task that I've waited 4 years to do that took me 15 minutes is done now.
Every bit of home repair. It's like, I can do that in 10 minutes, but I got to get all this stuff. I don't think I'll do it. Maybe something.
Right. and that's exactly it. It's like, there's just like some things that are just, we avoid because maybe it is a lot of response effort. Maybe it is just a stressor. Or maybe we have some kind of verbal behavior, or we've created some rule around it where it's like, this is the most stressful thing. It's like, it's really not, I promise. Just kind of, I think probably recognizing what those needs are is maybe the first barrier that we are experiencing in behavior analysis.
Now, for those of you who might be new to the podcast, or for those of you who might have forgotten, did you know that ABA Inside Track is ACE approved? By listening to this show, you are able to earn 1 learning credit. All you need to do is, finish listening to the show, then go to the website, abainsidetrack.com/get-CEUs. That's GET-CEUS, and enter in 2 secret code words that we've spread throughout the episode. I'm going to give you that first code word now. It is NAP, N-A-P. You know, nap. It's like sleeping, but not for a long time. Short sleeping.
During the day.
During the day. You could nap at night, I suppose. Or would that just be sleeping poorly? Who knows? Just sleeping poorly? Okay. In any case, nap.
Do you want to be a BCBA?
Sure, we all do.
Now you can come to Regis College in Weston, Mass. to get your graduate degree.
Choose from any one of these courses.
Masters of Science in Applied Behavior Analysis.
Masters of Science in Special Education.
Dual degree in Special Ed and ABA.
Or be eligible for your postmaster's certificate.
You can complete your degree and be ready to sit for the exam in 2 years. And our 2017 grads had a 100% pass rate on the BACB exam.
Come enjoy practicum placement support, ethics mini handbooks, PhD level professors, small class sizes, and a service trip to Iceland.
If interested, don't delay. Supplies are limited. Learn more at regiscollege.edu.
Again, that's www.regiscollege.edu, regiscollege.edu. One more time, www.regiscollege.edu.
See you there!
All right, and then let's get back to our conversation all about self-care.
So I want to turn our conversation a little more directly to burnout and then some of the articles that you suggested we read for the episode, Shane. And it's hard to say that there's any one summary take-home point from any of these, because since they're all using questionnaires and they're all using statistics, they even mention, I can't remember which one, but they even mentioned in some of them that the results they were expecting were not the results they got, possibly because of, say, like their small sample sizes. But I'd like to talk generally about sort of what are the themes that we see related to burnout? What can help burnout? What can increase burnout? How consistent is that?
I think that's a thing that we see a lot, is that I think people agree that there are some major symptoms of burnout, but I don't know that they have really pinned down any sort of one fix or one thing that works. A lot of times what you see is like self-care as a response, but it's usually is like a reactive strategy. They talk about it. If they were engaging in more self-care, or whatever that might look like. But the idea of burnout is it's gonna be interesting, because like for some articles, they'll measure errors on the job, like especially when it comes to like behavior-based safety, but not even in the behavior-based safety research. They'll look at it from like occupational research or something, and they'll talk about errors on the job. They'll talk about, oh, well, this person is losing sleep, and they reported lost sleep, and they reported stressors at home, and these effects carried over into the workplace, and this is what it looked like, or what we assumed it looked like. And so there is a lot of discussion around that, but there's nothing definitive about like managing the effects or fixing those effects, or kind of getting into that space, because they just don't know. The effects of burnout happen over long periods of time, right? Getting yelled at one day at work is not going to be as bad as 10 days at work, 12 days at work. It's just like that ongoing burden of those stressors are really, I think, it's a slow burn.
It did seem like, that it's not so much that, I've got so many demands and I've got so many, players at my job who are making it hard for me to do my job, or making it impossible for me to do my job, so much as it just goes on and on and on. So there's some like magical length of time, which I'm guessing is probably different for every single person, where burnout, no burnout, some burnout, less burnout. And then it does seem to sort of start with some of the components of burnout. So it's not like all the ratings of burnout that we talked about. So the depersonalization, the feeling you have a lack of personal accomplishment. It's not like, and all of those shot up. It sort of seems like some of the subsets of how they measure burnout currently, at least through the Maslach inventory, they tend to happen sort of asynchronously. But it's not even so much as, this is the exact trend we would always see, sort of as sometimes you see it like this. And sometimes this is the pattern we see for burnout to build up.
What I found super interesting when I was reading these articles and reading your dissertation, Shane, is when they found, I guess, a difference in age in burnout. I thought that was really interesting, with like older people getting burnt out more than younger people. And I'm also wondering, because it was correlational research, I'm also wondering because when you're older, you got more junk going on in your life, right? So I'm wondering, it might be interesting to look at research around burnt out and self-care in like a younger generations, like your 20s, just entering the workforce. You're like, you have that I'm going to save the world ideal, right? And you might lose that after some times of getting and beaten down, right? Or it's more competing contingencies when you're older too, because you may have a family, you may now have a house, which you probably didn't have when you were 20, maybe, right? But there's more competing contingencies around not just your job and saving the world. So that was one thing I thought was interesting.
But I don't even know if that was consistent, because I believe in the Plantiveau article, it seemed like age actually was a protective factor against burnout. But then each of these articles, overall, the overall percentage of burnout, depending on what population, where in the world they were taking their sample, I think one of them had really high, I can't remember which one had the highest rate of burnout. I think it was that Plantiveau, the highest rate, with like 48% saying they weren't satisfied with their work, and they were scored relatively low range for things like emotional exhaustion. But, even some people scoring high in the moderate range of sort of exhaustion, emotional exhaustion, depersonalization. And then other articles like the Dounavi article, I believe, the results were very different in terms of, nope, not that many people saying they're burnt out. Everyone says things are great. I'm loving life. There were only a few people who were upset. And when you're getting such wide ranges of responses, I sort of question, if someone asked me, how burnout do you think you are? What's your answer going to be? Because mine's going to be, nope, not at all. I'm perfect. Don't worry about me. Please keep hiring me.
Right.
I also thought it would be interesting too to look at, when like the age is a correlational factor. We didn't really talk, the articles, in the questionnaire didn't really talk about the reinforcers that were in the situation. When we're looking at self-care and looking at burnout, I think it would be interesting to look at, does reinforcement change, as your job gets harder, or easier as you kind of learn the job. I did find it a little bit sad that they said people with PhDs have higher levels of burnout. That means, yes.
We just carry so much existential dread because we know so much. We know that we know so little, I guess, is the thing, right?
Whoa, dude.
Oh, I know. That's this. A podcast on self-care, and I'm giving everybody an existential crisis.
Well, we didn't say it was promoting self-care.
Yeah, I think that the topic around age, and I think there's definitely something to be said about generational stuff too that's worth looking at. Right now my daughter will say that she's stressed out about everything. She's 14, she's getting ready to enter the workforce, but she's grown up in this space where even basic social interactions are a little bit more of a chore because you have kind of grown up in the age of social media and digital communication. And so, again, that's a sweeping generalization, but thinking of just those generational differences, like, not saying like, oh, well, do millennials have better self-care, but more the idea that, there are culture shifts and different social norms through each decade, through each year that come around. And so I just wonder if there's something there too. It's definitely worth looking at.
I know some of the other protective factors that, again, they weren't always protective factors, or mitigating factors, I should say. It seems to be coworker support does often seem to provide some protection, not all the time. Again, when you're looking at statistics, it was like when burnout was all about work stressors, then it was a protective factor. But if it was about something else, it wasn't as much a protective factor, because again, statistics. Supervision seems to be more important for, at least in the limited research that exists, supervision seemed to be a mitigating factor, but again, more so for, say, frontline workers or behavior therapists than, say, BCBAs, though it wasn't that supervision didn't help at all. Are these important themes we need to explore more? Are there themes that we actually have any, halfway definitive answers about?
I think there are some areas, if we can pull and maybe generalize from different topics or different subject areas. So, because I hear in OBM all the time, the idea that like a bad system will defeat a good employee every single time. And you hear that discussion, it's like, okay, so there's a systems issue that's going to burn out your folks, right? There's a field issue that's going to burn out your folks. There's all these things that are out there. And the problem that we run into is that, just like I said, we can generalize those principles and maybe pull from those other articles or those other fields. We can do that, but that provides a glaring, like that shines a spotlight on our research that we are just missing all of this. Really, truly missing all of it. Supervision sounds great, and it is great. And OBM supervision, like having your staff and your network, that sounds awesome. But like, we really don't even know because we can't even agree on a definition. We can't even study the concept, even though it is literally talking about behavior, self-care repertoire, self-care behaviors, what this looks like. We talk about boundary setting in our ethics. We talk about all the things that go into self-care in our field somewhere, but never in some kind of, there's no threat, like through line, right? They're not all connected. So we just have this hole in our field.
Shane, you can just, if someone asks you what's self-care, you can be like, guys, it's just a generalized operant.
That's what we should be doing from now on.
Right? And then just walk away.
Come on. Don't you know? But I think that's exactly it. Because you highlighted a great point. If somebody comes up to me and asks me what self-care is, it's the equivalent of asking what social skills are. It's not easily definable. It is a spectrum of behaviors, and it just, it can include really anything.
Mm-hmm.
Yeah. And will probably be an idiosyncratic, much to the dismay of our field, right? Where everything is idiosyncratic.
That's it. I learned the phrase, it depends. And that was the most freeing thing that I've ever learned.
I'm thinking even in factors that across, research in other fields, the peer network, having a good peer network. There's lots of research to point to. If you have a strong peer network, you're going to, score higher in a lot of variables, not just in terms of low rates of burnout or low job satisfaction. But then I'm starting to think, okay, what does that mean to have a peer network? Because is that a peer network where I have to be with people in person? Would an online peer network count? Like you were mentioning, Shane, is that going to vary from generation to generation? The generations that grew up with the internet, online peer network is going to be just as effective as an in-person peer network? Or are some of the troubles with having an online peer network going to, sort of decrease any positive effect that might have on job satisfaction or burnout or feelings of, good self-care practices? I know we've talked about just having an online peer network. It can be very good, but at the same time, there are a lot of ethical quandaries that go into your online peer network, because if you're turning to them for help with everything, that's not necessarily in best practice ethics, because you're going to be asking them questions that they don't have the answers to. Maybe they just should be your friends online. But we don't even know if that's that effective in terms of minimizing or mitigating burnout. Like it kind of is most of the time in some cases, but not all the time.
Well, right. And I think that's the thing is like, even in that context, let's say you're talking about a self-care technique that has to do with having a peer network or having support or having supervision. That's all great, but that's literally all work. So what about those self-care routines that have to occur outside of that context? Because it's great to have a peer network, but it's also great not to have to answer my phone when I'm not working, right? So, I think that's part of the context too, is what does good work self-care look like? I mean, I know that, I don't want to say I know, I can't definitively, I don't want to provide that sweeping generalization, but personally, I would say I struggle with setting boundaries. And sometimes I would take things on that I couldn't take on. I mean, this was earlier in my career. And I would take on all these projects that I simply did not have the time for. And, saying no became a really important self-care behavior for me to maintain those boundaries so that I could contact those reinforcers that weren't work-related. For me, reading is a big self-care thing. And while for a period of time I started reading again, I was only reading behavior analytic books. And I was like, okay, so I never leave this field. And so I had to go back and start reading Vonnegut again and being like, oh yeah, right. I'm definitely like a human being before I am a behavior analyst. So I need to do these other things. And I think just those types of shifts in our behavior are really important to note too. It's not just work satisfaction. It's not just our field. There are other parts of who we are as people.
I think that's a great place to move into our dissemination station section of the show, where we sort of talk about kind of what are the big take homes and sort of what does the future hold in the interest of learning more and researching more about self-care.
But mostly where Jackie makes the train noise.
Yeah. There we go.
Not as loud. Sorry, everyone. The train has lost its train.
We got to
sound.
upgrade it. We got to get one of those cool future trains, like Back to the Future 3.
I haven't seen it.
You got to see number 1 before you go to number 3. It's true.
That's true.
That's fair.
Can you believe that? Shane, You've seen Back to the Future, right?
Oh, yes, I have.
Okay. Jackie has not seen Back to the Future.
I just lied so that I'd have someone on my team.
I'm sorry, I panicked.
Back to the Future, that terrible film that nobody saw. I don't know what you're talking about. Yeah. Sorry, Jackie. No.
I wasn't going to say this, but recently my daughter asked to watch that, and she's 14. So I was excited about that.
Well, I watched it with her.
I did watch it with her. You should watch it with her too. She will love that.
Yeah, well, Netflix party.
We took our oldest son to see it at our local dollar theater when you could go to movies years back. It was real delight.
Oh, in the before times?
In the before times, yes. So, Shane, I'm not going to make you like we sometimes do with guests when we have a topic that has a huge body of research and there are some real definitive next steps and best practices. I'm not going to make you tell us what those are because they don't exist yet. But I guess you do have the enviable task of, since there's so little research on the subject, there are a million different directions that we could go with self-care in the future as a field. So you get to sort of be the purveyor of what are some good next steps that you'd like to see for researching self-care and improving self-care in our field.
Oh, I love that. So I think that we are on a good path where we're starting to turn the lens of research onto the behavior analysts themselves. But I think that's sorely needed. And so as we start exploring self-care, you're looking at who's engaging in self-care, what is the issue with self-care deficits, and there's a lot to pull from that. And all we have to do is just apply and replicate those studies into our field and see what that looks like for the folks that are doing it. I think that part's easy. I think the difficult part is going to be getting a definition that we can agree on and conceptualizing it in a way that is meaningful to the field, meaningful for intervention, meaningful for assessment even, and just start looking at what does self-care look like from a conceptual standpoint. And I don't even think we're even at that point in time. And so, yeah, there are a million different directions we could go. I think we need a good concept, and I think that we need to start really focusing on what is going to help grow our field, which are the BCBAs and BCABAs out there.
I know I'd certainly love to know more about what are the actual effects of poor self-care. Do we have any real targets where we could get some more performance-based research? So when certain things are in play, we see X. When some other techniques are in play, we see Y. It does seem like sort of from what's out there right now, like there might be some ways to start that work, but it might be premature to be thinking about this research in terms of outcomes, specific capital O outcomes of increasing self-care or decreasing burnout or whichever way. I like the way you think about it in terms of increasing self-care, where we're reconstructing rather than just looking at what is deconstructing or what does deconstruction do to us.
I think that's, the approach if we're looking at behavior change as a whole anyway is going to be, what do we do instead? What not, don't like talk about what we shouldn't do. Let's talk about what we should do instead. And, within that frame of looking at self-care, it's not just doing the things that we like, it's also doing the things we need. And so sometimes those deficits come into those spaces where it's like, I'm literally not doing the thing that I need to do. Just getting people to kind of start looking at that, I think, is going to be more constructive than looking at like, well, this is a problem. Let's avoid this. Let's avoid this. Let's avoid this. Because that research has been done in other fields. That research is still growing in other fields. Burnout is a hot topic in any sort of helping profession. There's literally an entire theory on skill deficits related to burnout. So, I think that's what we have to start looking at is like just making sure that we know where we're going with this, conceptualizing it and looking at how it's going to help grow our field.
So would you say that at this point there are sort of ideas or like an inkling of what some of those self-care best practices might be? Or again, are we just talking about that it depends, category of behavior where one person's best practice is another person's, ineffectual practice?
I think we are at the it depends place, but I think that we're finally at a space where we're starting to look at it as a set of behaviors and we can start conceptualizing it as some set of behaviors. I mean, like I mentioned, if you're reading a book that's not behavior analytic, then that's self-caring on some level, it's contacting some reinforcement somewhere. So, but yeah, I think that's going to be the challenge is looking at it depends. And I think that, definitions and just looking at how we conceptualize that is going to vary based on every person, their social significance, their current MOs, what they need versus what they want. I mean, there's a lot of different, I just feel like there are too many factors to look at without having to look at the individual and the impact on that person.
Right. Wouldn't it be really neat if we could define self-care based on the function?
Oh, that would be so good too. Or even doing like an FA on that stuff. Oh.
Yeah.
Yeah, I was thinking about if we just start thinking about being able to identify your values and your goals as a behavioral cusp. Because if you can do that, then you can work towards those types of reinforcers. And that was a clear distinction in your dissertation, Shane, was the people that could do that seem to have a better handle on how to best care for themselves.
When you say values, Diana, you're thinking like kind of, the way ACTS defines values.
Yeah. There's a lot. It's like a really exciting area. I'm really excited. And, as an educator, I'm trying to think about how can I best incorporate some of this into my BACB trainees and what they need to learn. And I've done, really rudimentary things with them, like let's try to compose an email to your supervisor that indicates that you need help in some area or you feel overwhelmed, right? Or let's try to do the same thing, but to say no, that you can't take on a task, right? And that might be one component, but there's likely going to be several different areas response class of behavior, like you're saying, Jackie, right? Like these are going to function in different ways. If we could help highlight what those are and have people work to identify those in their own repertoire, then they're going to be better able to utilize them at the right times.
Oh, most definitely. I mean, when I was kind of digging into this and looking at some of the other ethics codes that are out there and looking at our ethics code in comparison, and the only thing that our code says at all that has to do with self-care is anything that has to do with supervisory volume, not taking on more than you can handle. And that's it.
Or you get that one part of the ethics codes where it's like, if, stuff is hitting fan in your personal life, you should report yourself to the BACD.
Right. All that does is just punish asking for help, And so even like those simple things like modeling when you need like support, when you need help, asking for help. I mean, those things are self-caring in that you are working to relieve some kind of aversive event that you're experiencing, right? You're stressed, you're tired. I mean, and looking at self-care as teaching a set of behaviors, I mean, look at how it applies to parents. I mean, the parents that we serve are beyond stressed out. They're not sleeping. Your RBTs, your supervisees, your co-instructors, your whoever you're working with. I mean, as a parent, I could use better self-care routines, So it's just looking at it from that application, it's just like our science. It is the one science that can be everywhere. Social skills are everywhere for human beings. Self-care is everywhere. It's just a matter of defining it and getting people to do it.
Oh, well, that sounds like step 2, define. We got over 100 definitions. We should be able to pick one of them that makes the most sense. We talk about, the function of the behavior.
Right. There are 139 separate unique definitions. We could use another one. We'll just make it behavioral.
It does sound like the take home is we're sort of all leaning more towards the idea of self-care as a functionally independent like class. It's not just necessarily the same as, say, like automatically escape maintain behavior. The idea of I just got to get away from my stressors. There's more to self-care than that. Are we all kind of leaning more towards that?
Yes.
I would agree.
Diana, you're making a face like maybe I'm the only one who can see Diana right now. She's making a thoughtful face.
I'm just thinking about what I had said earlier, right?
Okay.
So like there's many ways that you could attempt to return to this homeostatic level, but some of them are likely going to be more detrimental for you in the long run. So it just depends on how broadly you're going to define self-care. Mm-hmm. I think it might make sense to whittle down the definition away from things that are so harmful.
But I think that comes back to the idea of looking at values as possibly kind of a nice entry point into what that homeostasis is. Because if I value good health, then self-care activities that have to do with like getting exercise are going to be more meaningful to me. Whereas if I don't value my health so much as I value learning new things or resting, perhaps even, more sleep or taking naps might be a more important part of a self-care routine, even though it might not be true for every behavior analyst. We don't all need naps. Like they don't need to put that in the guidelines. Everyone take a nap. I mean, let's that go in,
we might see a burst in our field. It's like, oh, this field requires them to take naps. I'm in.
Yes,
make sure to model napping behavior to your supervisors. Imagine you watch me. Take a nap. You sit there, you watch. I'll show you how to do it. Then I'll give you feedback later on your napping.
Oh, you didn't have your blue mat. Sorry, doesn't count.
All right. Well, I think we've covered a whole bunch in terms of self-care, the idea of burnout, sort of looking at sort of what are going to be some next steps and what are some sort of individual steps. So maybe a next step for folks at home will be to start looking at some of those values. What do you think of when you think of self-care? And hey, maybe you want to write in and talk about your own self-care routine. Please don't send us your drinking schedule, though. We don't really need to see those. I think we're moving beyond that in terms of self-care.
Yeah, I mean, we don't need your toothbrushing schedule either, I guess.
I bathe once a week. Oh, that's okay.
Okay.
Great. Well, thank you.
I won't see you at a conference. Okay.
Yeah. Actually, maybe it's good warning. Like I'll be over here. So Shane, thank you so much for being on the show today. Do you have any ways that folks can contact you or other work that you'd like to share with the audience?
Yeah, no, thank you for having me again. I think what y'all are doing are great. So I always love catching up with you. Contacting me, I'm pretty present on social media, so I'm out there if you find me there. If you want to shoot me an email, I'm perfectly happy to get emails from you and chat with you. So, I mean, however you reach out to me, I'm more than happy to talk shop a little bit. So,
what's your email, Shane?
The best one for behavior analysis would be stspikerbehavior@gmail.com.
Okay. Neat. Great. I didn't know that one.
Well, I usually use that one for behavior-specific stuff. So
Work stuff.
And then Shane, do you want to plug why we do what we do?
I keep forgetting that. I literally just recorded with Abraham too. Like Like left
your
that.
own podcast, Shane. Come on, it's important.
I know, I'm dropping the ball, man. We just recorded episode 175, Why We Do What We Do. We have a really special episode coming up soon in a series that we're coming up with that's going to be a lot of fun. And yeah, we talk about psychology from a behavior analytics standpoint and do a lot of kind of like myth busting and debunking of things and interesting histories. Like we just did one on syphilis. And we also did one on mad cow disease, and we've done some on Clever Hans, the counting horse. So we do a lot of different things on that show.
Oh, I remember him. So you myth busted there's no such thing as syphilis and there's no such thing as mad cow disease, you mean?
Yeah, pretty much all that stuff.
Behaviors around the field, I guess, yeah.
Right? So we're all doing that. We're over there. Like I said, we just finished episode 175. So it's called Why We Do What We Do. Yeah.
It's such a fun show.
Yeah, it is. We were really excited. Our episode's super duper old now. It's deep in the archives, but we had a lot of fun. We were able to come on and we enjoy listening in, especially because so many of your topics are just like, well, I didn't even think that would be a behavior related one, but it's so fun.
Yeah, we just recorded on left-handedness today, so that was the episode that's coming out, and you're like, really? Okay, like I had no idea. And it's like, I guess there are some things to consider there.
We want to say one more big thank you to Dr. Shane Spiker for coming on the show today. We had a really great time talking with him, and we hope you had a great time listening to the episode. Before we wrap up, I want to make sure to give you that last code word, that second code word. It is donut, DONUT. It is a fried circle of dough, sometimes with sugar on it or other flavors.
What's your favorite kind?
I love a good glazed stick.
Jackie?
It varies because I actually don't really like donuts. But if I had to take a donut right now, I'd probably take one with chocolate frosting and chocolate squirting out the middle.
Oh, okay.
Oh, yeah. I like cake donuts. So like a chocolate cake with a chocolate frosting is very good. Or I recently had a pumpkin spice cake donut that was real top notch.
Those are good.
I love it.
No!
You can never take it away.
You know that scene in The Wizard of Oz at the beginning when Dorothy's still in Kansas and Auntie Em comes out and gives everyone fresh crullers that she just cooked and everyone's eating these like donut things? I always thought that would be the most delicious donut, like Wizard of Oz donut.
That's fair.
I'm sure it was like a rock or something fake because it was black and white. Maybe they didn't need real donuts back then. I don't know what the rules were for Hollywood back then, but in any case, donut. And that brings us to the end of another episode of ABA Inside Track. We sure do hope you enjoyed it. We would love it if you listened to the show, maybe by, say, subscribing. You can find our show on Apple Podcasts, Spotify, Stitcher, Audible, I think we're on as well. Pretty much anywhere you get your podcast. There are a lot of other ways you can reach out to us as well. We're on social media. We're on Facebook, Pinterest, Instagram, Twitter as ABA Inside Track. You can find all of these episodes posted on YouTube with the YouTube subtitling feature. You can go to the website, abainsidetrack.com, where we have links to all of the articles discussed on this episode, as well as every other episode, as well as links to all the other episodes we've done for this show. And if you're interested in a little bit more ABA Inside Track, why not check out our Patreon page at patreon.com/ABA Inside Track, where at various tiers you can get additional podcasts, opportunities for social meetups, and additional discounts for CEs. Oh, and don't forget, you can always email us too at abainsidetrack@gmail.com. Sorry, I looked at Diana and you look like you were about to tell me. Don't forget the email. We couldn't make the show without all of us and the help of our great guest co-hosts. We also want to say big thank you to Dr. Jim Carr for recording our intro and outro music, Kyle Sturry for his interstitial music, Dan Thabit of the Podcast Doctors for his editing work, and Hollis Irvin from the Sycamore Workshop for visual design. We'll be back next week with another full-length episode, but until then, keep responding. Bye!
Bye.